Hello, my name is Anna Marie Roth. I go by Annie. I am talking today in regards for being a caregiver, patient advocate slash taking care of someone who is in pain. The person is my husband, and his story is back on 11/29/1999. He was picked up by a backhoe and smashed into a metal fence, and he was the sandwich in between. It crushed his left side and left him with a very debilitating disease, which is pain. He has CRPS, which is complex regional pain syndrome. If you don't know what that is, please look it up and read about it. I believe that ignorance is not bliss. He also has thoracic outlet syndrome type 2, which is neurological. He had a lot of nerve damage, a lot of tissue damage. I have taken care of him for 11 years. During the 11 years, I've watched a decline of him being able to do things that a person of his age, between 36 and 47, would normally do. When I met him, he was 225 pounds, and he looked absolutely wonderful. Not that he doesn't look wonderful now, but now he weighs 150 pounds and spends a lot of time just doing the things of daily living. As far as impacting our family, our vacations are tweaked just a little bit. It's called adaptability. We don't go to motels or hotels. They don't have reclining beds or recliners that he now needs to sleep on. He can't walk very far because it has affected his left leg. It has affected his left arm. People in the healthcare profession who are not familiar with pain issues have told him, "Oh, you just got a crush injury, a chest contusion. Let's put you. You can go back to work." Well, that's not a possibility. I've asked these people if they'd like to come and stay at my house for 1 week and try to take care of him. He has his good moments and bad days. Pain encompasses the whole family. It's not just the person with pain. When Danny first got hit, we were invited to be in a support group at Harborview Medical Center. Out of 14 people, he was the only one that still had someone with him, as being a support person, being a spouse, being a family member. He was the only one that had somebody who was there and who was acting as a patient advocate, keeping track of medications, looking at things coming down the pike, doing research. This is what's going on. This is how it's progressing. This is how it's plateaued. I've learned the difference between a pain specialist and a pain consultation. I know the difference between a primary care doctor and an internal medicine doctor. And I've learned the difference between what a good occupational medicine doctor will do and what one who is following policies and procedures of the places that they work for will do as far as pain control. I believe that the legislation in Washington State needs to be aware, needs to have more knowledge on the things that they're trying to take away from people who are trying to get a quality of life. But people don't seem to understand that there's a difference between a pain relief seeking patient and a drug seeking patient. There's 3 major differences. One, the pain relief person will sign a contract with one doctor, have one pharmacy, quality of life will go up, and usually have medications left over. The person who is drug seeking will sign contracts with a lot of doctors, not have one pharmacy but have many, and their quality of life goes down because their body does not need the medication. going to ERs here in Washington State, in the Puget Sound area, a lot of the emergency medicine doctors are not familiar with pain management. And in Just Course are people who have pain, they're automatically judged as being drug seeking. Therefore, they get let go without adequate pain relief. My time is just about up, but I encourage anybody who's listening to this to be a part of the American Pain Foundation, or at least do some research. Don't settle. Suffering is just an option. You need to realize that you can fire your doctor like you can fire your carpet cleaner. If they're not doing a good job, you're not going to use them again. And it's the same thing with a doctor. If you're not comfortable with what the information you're getting or with the relief you're getting, it's okay to fire them. If you happen to have someone with a lot of medical issues or challenges, finding a different doctor is going to be hard. If you stayed with the same doctor forever and you get hurt in an instant of a second, is this doctor going to be able to take care of you or willing to take care of you? Especially with the new laws that are coming out in Washington State and the DEA. I encourage education. I encourage listening. I encourage asking a lot of questions. Write your questions down. If you don't get adequate answers, then you know that doctor is not for you. Thank you very much for your time, and have a blessed day.